Hello, and welcome to my case study on pediatric respiratory. So this case study is about a 3-year-old, CM, who presents with a one-night history of cough, nasal congestion, and a temperature of 99.4. So the assessment that the nurse performs, first asking what type of cough does the child have? Is it harsh? Is it productive? Is it dry? Is it like a bark, like a seal? And also, while the nurse is asking the parents these questions, the nurse will be listening to see if he or she hears that cough while the child is in the office. Next, the RN is going to ask the parents, do you feel that the cough is worse at night? Or is it worse during the day? Is it worse after the child is active? When is it the worst? Then you're going to ask the parents, is there any wheeze associated with it? Or does the child cough so hard that they're vomiting? Next, the RN will ask if the parents have noticed any retractions, and most parents don't know what this is, so you will explain that, what retractions are. And also you'll be looking at the child to see if you can notice any retractions. So you'll probably have to lift up their little shirt so you can see if they're having any retractions or not. Next, you want to ask the parents, are they eating and sleeping okay? A child that is refusing to eat and refusing to play is a lot more sick than a child who is maintaining their eating and their playing. And then lastly, you want to ask if there's been any fever. Many times the child may have taken Tylenol or Motrin before they, acetaminophen or ibuprofen before they come to the office. So you can't just guarantee that what the temperature is not affected by a medication. So you're going to ask the history. Is the child having any fever at home? And if so, how long? So retractions. Retractions pens up. You really need to understand what retractions are in pediatric respiratory conditions. So kids have, if they are having a hard time breathing, they will suck in so hard that you can see them sucking in at different points on their chest. So you'll notice it here on the top above the sternum. We call that suprasternal retractions. They will have it above the clavicles where they're sucking in. You can see that there, called supraclavicular retractions. They may have intercostal retractions, which are in between the rib cage or in the intercostal region. And with each deep breath in, you can see the outline of the ribs. Or they can have substernal underneath the sternum, or subcostal or underneath the costal margin, so beneath the rib cage. Any of those. And sometimes I've seen kids come in when parents are complaining that they're coughing or having a real bad cold, and you'll lift their shirt up to examine the chest and you'll notice these retractions, and you can ask the parent if they've noticed those. And many times they'll say, no, I haven't. Unless the parent is bathing the child, they may not look that closely. So you want to point that out. So what are our findings for this child? Well, the child does have a barky or a seal-like cough. So the nurse doesn't hear it so much in the office, but the parents describe that the child is having a barky, seal-like cough, and it kind of sounds like this. Oh, 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 oh. The cough is worse at night, and the parents described that it came on suddenly last night. The child seemed fine, and all of a sudden they had this barky cough. The child is not wheezing, and that's usually an expiratory wheeze, like asthma, where it's he, kind of a sound that sometimes you can hear with just a stethoscope, but the parents are not describing any wheeze. The child is not coughing so hard that they're vomiting. Sometimes kids with asthma will do that, or pertussis. The nurse does notice suprasternal retraction, so as the child breathes in, so the child is having this barky cough, and then like that. The child is eating and playing okay during the day. There just seems to be a low grade fever, like 99, 100, so nothing super high. And yes, the child is having this inspiratory stridor that came on last night. So, what is our diagnosis? This is croup, laryngeotracheobronchitis. It is a barky cough. It is inspiratory stridor sometimes, not all the time, but sometimes it does. There's minimal coryza, which means cough and cold-like symptoms, just minimal. It usually occurs in children aged 3 months to 3 years old, but it can occur in children of any age. Usually it does have a sudden appearance at night when the child is lying down. The fever is variable. It usually does not get very high. Child does usually not have any trouble swallowing. And it is a viral illness that causes this. The child usually has what we call a non-toxic appearance, which means not super sick looking. When we say a child has a toxic appearance, we mean they look really sick. You walk in and the child is laying on the exam table like a little wet noodle. That's toxic looking. Children with croup do not have this toxic appearance. So what is our management of croup? Number one, we want to always have the child sit forward when they're having this coughing episode. That helps. Or encourage the child to maintain a comfortable position. We don't want to force them to lie down. Sitting up actually helps. We want to encourage them to drink fluids. So water, juices, things like that will keep the secretions not so thick, because they don't have a lot of secretions, but you don't want to make those even thicker. And they will have fluid loss, from coughing so much and breathing faster. They will have insensible losses increased, so they'll need to replace those fluids. We do want to keep the child resting as much as possible, so this is not the time to make sure that they attend soccer practice, because that will just get their coughing worse. We want to have the child rest as much as possible. If they notice stridor, which is this sucking in sound, usually that'll happen in the middle of the night or late at night. And we encourage parents to bring the child into a bathroom and turn on a hot shower and let the child just breathe in the steam. That seems to help cough and the stridor. Another thing that helps is cold air. So you can have them just open up the refrigerator or freezer door and have them just stand in front of that and have them breathe. We know this from many times when they page us in the middle of the night to say their child is coughing so bad and it's barky and they're having this sucking in sound of stridor. And we encourage them, okay, well, take the child to the emergency department. Many times by the time they get to the emergency department, the cough and stridor has stopped. And we think this is because of the cool air of the night. Next is to administer corticosteroids as directed. Croup is a virus which causes swelling in the vocal cords. So we want to give an anti-inflammatory steroid medication, maybe just one dose, like a dexamethasone, or a couple days dose of prednisone or dexamethasone. But remember from your pharmacology class that long periods of being on corticosteroids do need to get weaned or tapered. But when you're just giving a couple days dose, you do not need to wean it off. We also want to be very clear with the parents about when to call the provider. If the child is breathing faster, has more of these retractions, difficulty breathing, if the nostrils are flaring with each breath, or if the lips have a dusky bluish hue to them, that means that not enough oxygen is getting to the body. If the child is coughing and having stridor in the middle of the night and the parents bring the child into the steamy bathroom or outside or in front of the freezer door and it doesn't go away, they need to take the child to the emergency department or call the provider. If the child is acting restless or confused, definitely call the provider. And what this may be is hypoxia. We know this if you think about if you've ever been in and around a water source, a lake, pool, and someone is um, not able to swim or they're struggling to keep up. What's the look of anxiety that they have on their face? They look anxious, right? Because it's a natural instinct. If you're worried you're not going to be able to breathe, you get anxious. So if a child is not, or an adult, ends up, if someone is not getting enough oxygen, they may act restless or confused. And then if the child is drooling and not able to swallow, the throat may be so swollen that they're not able to control their secretions and swallow. It definitely needs to um, be a call to the provider. So that is it. Bye-bye.